Hello. Right. Dr. Sugat,
Yeah, shall we start now?
shall we start? Yeah, we can
Yeah.
start now.
Uh,
Chintak, are you ready?
yeah.
Yes,
Good
yes, sir.
evening. Good evening to you all. Thank you very much for joining our webinar today. Our topic is Sri Lanka Veterinary Public Policy for Global Health Challenges. Our resource person is Professor Ruchika Fernando, Professor in Veterinary Public Health and Pharmacology, Head, Department of Veterinary Public Health and Pharmacology, Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. Thank you very much, sir, for your accepting our invitation today for the webinar. And our moderator is Dr. Sanjika Pereira. Thank you very much, Dr. Sanjika Pereira, for accepting our invitation today. Without getting much time, I would like to invite our president, Dr. Mohammad Ijaz, the president of Sri Lanka Veterinary Association, to welcome you all. Dear President, over to you.
Thank you, Dr. Sugat. Chintika, can you take my videos? Chintika?
Yes, everything is going well.
Can you see my video?
Yeah.
I can only see Sugat. Can you hear me?
Yes, we can see you.
Yeah.
I can see you. All right. Good afternoon, everyone, and thank you very much for joining us for this much awaited and interesting topic. And we have organized this event to mark the World Veterinary Day. I think this is a much important for every veterinarian. It's a new stream of thinking, and I would like to make this opportunity to make further action rather than just keeping quiet. We'll take from this end, and we have to move for another step. And thank you all for joining us for this much awaited webinar series. And I would like to hand over again to Dr. Sugat Premachandra for the proceedings.
Okay, thank you, dear President. Now I'm going to introduce our resource person today, Professor Ruchika Fernando, a professor in veterinary public health and pharmacology, head Department of Veterinary Public Health and Pharmacology, Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. He area of research is food safety, zoonotic disease, genomics, and nanomedicine. He received national and international contributions. Vice President, Sri Lanka Veterinary Association, Secretary, Sri Lanka Veterinary Association, Member, National Codex Committee of Residues of Veterinary Drugs in Food, Technical Assessor, Sri Lanka Accreditation Board, Member, Technical Advisory Committee on Good Laboratory Practice of Sri Lanka Accreditation Board, National Project Coordinator and Chief Counterpart, IAEA Technical Cooperation Project, National Project Coordinator, IAE in Regional Project, National Project Coordinator of IEA Inter-Regional Project, and Secretary, Academic Affairs and Specialties Subcommittee, Sri Lanka College of Veterinary Surgeon, Chairman of the Subcommittee of Academia, Student Affairs, Career, Professional Skills, Development of Food Safety, Asia Network, Chairperson, University of Peradeniya of Safety Committee, Coordinator, University of Peradeniya, Hazardous Chemical Waste Disposal Program, President, Federation of Peradeniya University Teachers Association, Chairman, Planning Committee, Faculty of Veterinary Medicine, Chairman, Board of Study on Veterinary Public Health and Pharmacology, and he received many awards. National Award for Excellence in Agricultural Research 2017, first place in livestock and fisheries sector in recognition of the research conducted in establishment of method to ensure chemical and microbial safety of food of animal origin. research and development grant he received, 6 local grant and 6 international grant. And he has patent also for a simple diagnostic platform based on RT lab techniques to diagnose patient infected with SARS-CoV. Other one is a method of deactivating anti-clotting agent used in blood feeding by parasites or insects. So without getting much time, I would like to invite our resource person, Professor Ruchika Fernando, to conduct the webinar. Before conduct the webinar, I will give you guidelines. This webinar lecture will be 40 minutes. After 40 minutes, there's a Q&A session for another 20 minutes. Our moderator is Dr. Sanjay Pereira. I think all of you help us to continue this webinar in very successful way. Thank you. Over to you, Professor Ruchika.
Thank you, Dr. Sugat, for the long introduction. Good afternoon, everybody. First, I think I shall thank the SLVA President and the Executive Committee for inviting me to deliver this webinar as part of the work organized to celebrate the World Veterinary Day in year 2024. When I was invited to provide a suitable topic for the webinar in line with the World Veterinary Day theme, veterinarians are essential health workers. In my mind, I didn't have any doubt about it. Of course, we all are essential health workers. And I thought I would select a broader topic due to several reasons. As a nation, we have issues with our public policy formulation and revision process from education, especially with respect to recent introduction of National Education Policy Framework, to finances on the day we became bankrupt in 2022. We all have issues with our policy formulation and the process. I don't see there's any exception that we have this for the field of veterinary medicine. Also, this is like new. I think it is new to open in public, though policy formulation is not new. Also, please note that I am presenting certain views of mine as an academic on the Sri Lankan public policies related to veterinary medicine, and they may not be essentially aligned with the official stance of the Sri Lanka Veterinary Association. This is basically an academic type of talk, so that we can have a discussion at the end to move from there onwards. Now, when I first give the topic and the flyer was out, there was like a lot of
Professor, we lost.
Professor, we can't hear you.
Of debate.
Professor Ruchika.
Yeah, Dr. Sugat, I think there was an interruption. I got
Okay,
it.
now okay. Yes, now we can see you. Yeah. You can
Right,
continue.
yeah, produce it. Right. Now I guess it's. When did you hear me last?
This slide, yes.
Yes.
This slide, like, okay, I don't know how far you heard. Like, I will restart this slide. Sorry for the inconvenience. So when SLVA sent this flyer out, inviting flyer out, publicizing about this event, many had lots of questions like about this veterinary public health policy, and some asked like, can we share the this type of document if available. And also some were asking whether it's a draft, who worked on it, whether the committee has developed such public health policy. So that I thought it's a very good timely topic that we have selected to people to discuss and understand what is this public policy and what are the policies that we have related to veterinary profession. So, and such feedback indicated the importance of the topic and the need to raise awareness about what is public policy and the process of making public policy and what factors shall be critically looked at or studied when making public policy to make them effective. First, I think let's look at, before going into look at what is public policy, let's look at something even simpler than that, which is social institutions. Right now, when we talk about social institutions, they are established patterns of beliefs, behaviors, and relationships that organize social life. Social institutes exist to meet the society's fundamental needs, such as providing a structure, guidance, and order of command. Common examples of social institutions are like family, religion, education, maybe government, right? These social institutions play a crucial role in society for several reasons. Especially, let's say, family. They provide emotional support, nurture, and care for individuals and help in socialization and upbringing of children. Families are also, like, if you take as like families also serve as a primary source of identifying and shaping individuals' values, beliefs, could include religious and cultural beliefs, values, and behaviors. Additionally, they contribute to the stability of communities and societies. Right? There are lots of functions of this. There are lots of functions of these social institutions. Right now, for an example, the family, this social institute regulates sexual behavior of people. For an example, that I think for a long time, this has developed to regulate something. What is that? Family, maybe like not only sexual regulation, but there are certain things. One is sexual regulation. Families regulate sexual activity of their members control the reproduction so that it happens within certain specific boundaries. This happened long, long ago. So that is how it evolved. There is no society which leaves people to express their sexual behavior as they want. In no society that is accepted, even the Western cultures, right? But these behaviors are being controlled by a set of unwritten rules called norms, values, taboos, right? Unwritten rules, as well as certain formally established rules, which are law of these countries. So, and also we have to understand in when you are making policy formulation, sometimes these unwritten rules and sanctions play a stronger role than the written rules. That we have to understand. Those are sociological phenomena, right? Sometimes these sanctions may be very strong, unwritten, but they affect individuals' culture, individuals very much. Like if you think of like Eastern cultures like Japan, if you do some violation, even people would not, talk with you. That creates a lot of pressure on individuals to do things in common ways, like socially acceptable ways. So we have to consider all this when we are thinking of making policy. I just wanted to give you a sort of glimpse. And now for an example, if you like, I'm getting a small example. The impact of social institutions on value chain. Now let's say, what is a value chain? It's a progression of activities that a business performs in order to deliver goods or services. It's a process of progression of activities to deliver goods and services to the customers or end users. There's a great impact of the social institutions on, like for an example, let's take food of animal origin value chain, right? In this example, there are lots of religious constraints on food habits and food preferences. For example, some do not consume beef, some pork, or sometimes certain religious and cultural groups like don't eat meat at all. Also, some are against slaughtering of animals even for food purposes. They're more on talking about animal welfare, animal rights. So, I mean, these social institutes like religion, race, ethnicity, class, these all play a big role in all these value chains or whatever we do on a daily basis. These are informal rules. And they bear, as I said, a strong. They have a strong bearing on. Formulation of formal laws, right? And regulations, rules. They have a strong bearing because norms sometimes after a long time maybe become rules and regulations. Sometimes, not always, but. And also now, right now, not only that, like these social institutes, this informal mechanism, not only have influence on the formal rules, but they also have an impact on access to markets, relationships between customers and producers. And also, like in terms of like not only that, like service providing services necessary to run these industries. Like for an example, if you want to find a butcher, I don't think that anybody would just accept that job. It's not all about money. They look at many other things, like when they're accepting jobs. Right, so that we have to look in like the prestige and cultural and religious influence, so that even the service providers would have to critically think about like when we make policies to foster industries, we have to think about who's going to provide services, what would be like the acceptability norms of the society on these different things, etc. We have to have a strong attention paid on this. And also, I think like there is no 100% right and wrong in any of these social, norms, issues, concerns. So that actually now what we have to do is when we are making policies, formal rules and regulations in a country, we probably have to pay a stronger emphasis, attention on these things to have a good policy with positive outcomes. Now, if you go a little beyond that, like let's say in Sri Lanka, if you get candy, how would you ensure safety of meat? Right? We are struggling with establishing and running even a slaughterhouse because of this religious and other norms, while the entire world is doing things in a different way than us. Right? So now you would understand very clearly the weight of this. Like now we do eat animal food and meat, but now if you can't run a slaughterhouse, and also when you don't run a proper slaughterhouse, there may be other things coming into play, like there is not enough emphasis on animal welfare, and various other groups will also have various other concerns in this whole process, right? We cannot take anything in isolation, but it's a sort of a very tight network driven by formal rules, informal rules, and their interrelationships. Now, when we look at what is public policy, let's keep the word little inside a bracket, veterinary. Public policy is a broad term, refers to the policy or plan of what to do that is formulated and implemented for the benefit of the public. That is very important. Formulated and implemented for the benefit of the public. They are generally goal-directed course of actions, goal-directed. Now, when we take the veterinarians employed in the government sector, their primary role is to formulate, deliver, enforce, and maybe evaluate programs pertinent to public policy. Right? They are supposed to formulate, deliver, enforce, and evaluate various programs related to public policy. Right? And also, now, but also veterinarians in the private. And also the veterinarians in the private sector and academia also contribute to shape public policies. Right? And public policy decisions of government officials and agencies affect the society. They are basically have a bearing on the society. Now, to make this idea more simple and clear, let's consider some veterinary specific situations that I have listed, which contribute to global health outcomes, right? So that now when you think of like the situations like veterinary public health, animal health, livestock economics, animal welfare, pharmaceutical product regulations, manufacture, veterinary education, veterinary workforce, human-animal conflicts. I mean, we can think of many different situations and issues, right? But when we are making the policies for these, we basically go through a 5-step process. I mean, some people can break it into even finer, but These are sort of the broader 5 steps, right? So after, like now, when there's a problem, public attention focuses on the problem or the issue. That is inevitable in most cases. Then the officials will work on it, and their words and actions will help to focus the attention on the exact problem. Right? Then this will go to policymakers, and then they create legislations, regulations, and programmatic strategies to address the issue. It is not just, we are not just talking about one document or one policy. I mean, this has a very broad scope, right? Then what happens is, once the policies are being formulated, policymakers formally adopt the policy, solution for the problem, usually, not always, in the form of a legislation or a rule. Then what happens is that is policy adoption, right? That is policy adoption. Then the government agencies and relevant other parties, they work on the same issue by establishing procedures based on these policy directions, writing, guideline documents, guidances, lower level working instructions, and also maybe they may help technically and financially certain groups, certain governments, certain agencies to bring about the change that is expected by formulating this policy. And also after that, we have to keep on analyzing the policies that we have implemented to see whether they bring the desired outcomes. If not, we have to do changes, adjustments to these policies. Otherwise, they are not going to work. I mean, I don't think that anybody can make a perfectly fine policy at one go. But we might have to do small adjustments to make them more effective, right? That adjustments can come from within the government and based on the feedback of extra governmental organizations, peoples, activists, whoever are interested, can consider both these inputs. Now let's look at our examples, right? Preferences versus outcomes. Now we had, if you look at in broad, all these had a bearing or impact on veterinary profession. Government borrowings, like policy for government borrowings for development activities. I think their short-term preference was to have a good economic growth in a short run. But somehow in 2022, the country ended up in bankruptcy, which affect almost all the sectors. And also another example, rapid transformation to organic agriculture, right? Did we look at data? Did we look at other people, how they have done, how people have failed? Did you look at research findings? Did you talk to experts? I mean, these questions are with us. Rapid transformation of organic agriculture. The government's expectation was to make food safe very fast. And it ended up in huge food insecurity. And also importation of eggs, decision to import eggs. Like, I know government wanted to protect consumers. The price was little high, so they could bring eggs for a cheaper price, of course. And then did we consider other long-term effects like potential introduction of new diseases to the country, damages that could happen to the layer industry on a long-term basis. I think these are classic examples of what to not to do, right? And also, like in the past, we know what happened to what happened by importation of dairy cattle. We wanted to increase the milk production. That was a sort of a short-term goal. And what happened was like because of the way we did it, it ended up in introduction of new diseases and also many closure of already running many dairy farms. Even very recently, a bank called me and came and asked, like they wanted to see whether refinancing this bankrupted farmers because of this poor production of these imported animals will do any good. They wanted to talk to experts. Then I directed them to the farm animal and get opinions whether they can refinance these farmers because these people have lost their already houses even because they have mortgage to get loans to buy these high yielding, so-called high yielding animals. So those are our, past history of taking decisions. And also like another example, always impacting academia is taxing of research goods and need of cabinet approval for research grants. It causes like, I know why the government wanted to do it. There were a few abusers. And then they put a blanket, regulation to control everything. And the overall long-term impact is very drastic on these issues. These are like, our past. And then we have to look into these and we have to learn and do things properly in future. Now, and also when we look at, I think this is only like my perspective, but you would know more reasons why they fail. Why did we fail in the above situations? Right? The first thing is we were not looking at solid data. Most of these decisions were based on subjective opinions of top level people, right? Political influence, subjective opinions. And because of the same reason, because they're not driven by data, policy change from government to government, because these are ideologies for them, not data-driven, solid ideas. Now, very recently, I can remember when the Dutch ambassador visited University of Peradeniya, she was telling like, all our policies are based on data. And we know how good they are doing. I mean, I don't think they are perfect, but they're doing very well. Right? And also over and above everything, we have corruption at all levels, which could impact this overall because of the personal interests. Right? I mean, I know like when we talk about this, this type of, talks can hurt some people, but we have to tell the truth. Right? And also, another thing I think is like, this is what I personally believe, I think we could do better in terms of our interest and commitment to make things better. And also, and most importantly, we have to pay attention on attitude of our people. Because if we don't look at the attitude of our people, social norms, values, and other things in the country, sometimes our ideas may be good, still they may fail because of these informal problems. A few other reasons and examples. Sorry. Few other reasons and examples is like for these issues are like lack of evaluation of policy in a timely fashion. Now, these are my own views. So now for an example, if you take rabies ordinance, now we are more talking about animal welfare, and it has become very difficult to seize animals and destroy animals. They are almost impossible to do. And I think we have to go forward and change things in a positive way that is acceptable to the society. Otherwise, we won't be able to do a good job. And also, like, let's take another example: aflatoxin in food, like, and feed. If you really look at our legislations were established in 1990s, early 1990s. It's about 30 years ago. The technology has changed. The data coming from risk assessments have changed, but we have not changed. So these are the issues that we have to deal with. And also, like, for an example, another example is like the decision to use. I'm just taking like random examples. This is not geared to hurt anybody. Like, this is some of the examples I got to my mind suddenly. Right? We have banned the use of aminoglycosides in food animals. But in the world, based on data, aminoglycosides and streptomycin is being used on food animals, and there are mRNAs. Let's say there are established safe limits. So I think it's always good to revisit. Rather than not looking at them, we can always revisit. And also, like, I took one other example, like it's sort of it's a sort of we can debate on this one. Import authorizations of antimicrobials, like when importing, pack size keeping below 1 kg. One fine day, the customs call me and ask, there are 500 1 kg packs of some particular antimicrobial, and they were asking various questions to get clarifications from a vet. Right? So I don't say whether it's good or bad. Sometimes it may be good, but like we have to look at the data and see whether they have done. I can remember once somebody said, like, they have seen an overall reduction. If it is, that's good. We need that data. I think it's there. So that, I mean, we have to go like that if it works. And also, it's good to evaluate these settings time to time to see whether people are, taking on other paths to evade these regulatory restrictions. And also, we take extended duration of time to revise policies. I don't know that, like, now for the longest time, when we were involved with like this food safety, implementing food safety and feed safety regulations, they take a long time. I think we have to work on a way that we can do things fast, because they are important. Like I can remember, like, now we were discussing about aflatoxin issues in like 2019, and still I am not sure whether these have been passed out as law. So I think they take extended durations, maybe because of various reasons, but still I think we have to really think of what would be a time frame to implement this policy. At least the start, formulate, and a formal adoption of the policy. And also, of course, we know that there are lots of financial constraints, and also we have a lot of limited information sharing among different organizations. And also, if we can digitalize our systems, from payments to, I think now the world is going in that direction, so that we can do things more efficiently. We have to think of these new ideas as well. And also, when we think of research data for informed decision making regarding policies, I think we have a fairly good system. We have the Veterinary Research Institute, VICs, and also field vets are doing their own research at their capacities. And also there are universities, and there is Peradeniya University among them. And there's vet faculty, not only vet faculty. If you really look at like agriculture faculty, and there are lots of other faculties actively doing research in areas either overlapping or when in a sort of area that we are taking under One Health approach. So there are lots of good publications coming up. Now last year VRI has come up with 16 full journal articles, with faculty 49. I think if you sum up the total, like if you think of like maybe 100 good solid journals or journal articles may be coming in every year. So what is the mechanism that we are going to study the issues discussed in this and make a priority if necessary, and then we have to have work, we have to have a mechanism to work on these issues until we are very late to take decisions. We have to probably, the ideal is to be a little proactive and identify issues. And also, my expertise, like mostly food safety and infectious disease control, diagnosis side, so that I was going to show you some few data that make all of us interested in like bringing up the necessary change policy to ensure consumer safety. Now, actually, this research was done in 2022. I think we published this in 2022. Occurrence of antimicrobials in chicken meat. We highlighted the issue. Now there's data, agenda setting is done. People are aware. And I think we are probably in the process of looking at MRL, so that I hope that now, if you look at this, like 27 out of 77 samples were positive for at least one antimicrobial. And only out of these antimicrobials, MRLs exist for tetracyclines and enrofloxacin or fluoroquinolone. So for others, we don't have MRLs, like even Codex or EU they don't have MRLs. So their safe use is not guaranteed and ensured. And what is the effect on the environment of this high use of antimicrobials? So we have to think of this, right? And come up with quick, and effective solutions. Then we looked at the antimicrobials in eggs as well. These are published. They also, like about 20% of the eggs had antimicrobials, and there were sulfonamides which are not supposed to fed to layers. So that I think we have to work on this as well. And then we looked at feed. Feed also, we found there are some issues. I think there are rather intentional addition, or we need to confirm whether they are intentionally added or there are contaminations coming from synthesis of a medicated batch. So whatever, but there were traces, and some had little higher levels of antimicrobials, like 18 out of 60 different samples that we analyzed for 30 different antimicrobials. And especially, I'm very much concerned about aflatoxins in feed. Now, this research was done in 2019, and then 19 and published in 20. And then we communicated the relevant information to relevant parties, and then they started working on it. But I think we can have soon some effective regulations and policies on this. I know the work is undertaken, and probably to the best of my knowledge, these are at the level of legal draftsmen. But I think we need them fast, because aflatoxins in feed, we are good in terms of ochratoxin, no issue. That research is also important to show that there's no problem. We didn't have a big issue with ochratoxin A and fumonisin, so that we have to less worry about this at the moment. So they were mostly in right levels. And now my concern about aflatoxin in feed is that we found a lot of milk samples contaminated with aflatoxin M1. And we have had discussions with the Consumer Affairs Minister at that time. We actually talked to manufacturers individually and warned them, but I think we did not have a good follow-up plan to keep them aware of that and keep them controlled. So again, I see that this issue is coming up with the recent samples that we are analyzing. And also this is like the cheese. This was analyzed like 6 months ago. We analyzed about 50 different cheese samples. And also, to our surprise, the cheese Sri Lankan regulatory limit is much higher than others. Like you can see it here, Sri Lankan 1 ppb, Codex 0.5, EU 0.2. EU, you don't have one standard. Dutch 0.2, some of the countries 0.25. So they are having various levels, but let's take general majority use 0.25. So still we had lots of violations. And if you see, like if you get real quality control, this type of manufacturer should not be in the system. Manufacturer D, right? So this type of people should not be producing cheese for our children. Right? So, I mean, now we have the agenda setting. And also, when we talk about the data, it's very important that our data is reliable. We have to carry out proficiency testing. Its ideally methods should be fully validated. And also preferably accreditation should be there. Otherwise, at the present context, people are reluctant to believe the data. Now let's like this would be my like final slide. So that I mean now let's say we have identified a problem. Let's assume. Now what do we have to do next? Right now we have to go back to our original concept of how do you make public policies. Agenda setting. Agenda setting is done. That's data. So now it's about like officials taking into these considerations of the data and start an internal process. It's already started for many of these areas. And then we can have a discussion with the relevant stakeholders. I think we have had a couple of discussions. And also then we have to probably decide on, adoption of the policy. And I know industry, we have to protect the industry. We can't destroy industry by putting, rules and regulations, because food security and all these are very important. They have to be there, part of the game. So I think what we can do is we can come up with MRLs, talk to the industry, and then look at their problems, and potentially like we can agree on mutual dates when should we enforce, right? Because the public health is #1 interest. We can't compromise that. So we can think of potential days of legal enforcement. We can provide grace period. And then we have to establish mechanisms to support the industries to comply to MRL regulation. It's not like the policeman's job. You have to help them to come up to the right standards. You might have to give technical support when necessary. Maybe there should be funding identified to support them. Sometimes some industries they can probably cope on their own these additional burdens. Probably we have to talk to them and see. And then the most important is once you put the regulation, like now we have regulations for some like aflatoxins in milk. We can't add antimicrobials to feed. But the other important thing is now once you establish the regulations, we have to once in a while we have to do a checkup. like we have to see whether the system is working. It is not our idea should not be to penalize, but we want to broadly look at whether the system is working. Rather than taking them to courts and tarnish their name, I think we have to just see why these violations happen. I mean, there may be punishments, but we can decide on at what level at the beginning. And then we have to have a surveillance. And also when we think of surveillance and monitoring, sometimes we have a feeling like we need a lot of money, which is not the truth. I think we can start very small, like maybe 50 samples, 100 samples a year is a good number for the beginning. So even if somebody if the government entity cannot establish the labs that drastically, I mean, we have to all work towards a network of laboratories, but they can probably get services hired from other laboratories, which is initially cost effective and time efficient. But later, I think we have to develop a good laboratory network in the country, because we cannot completely depend on one lab. We have to have several labs, like different levels, reference labs, and maybe the labs doing the real enforcement work, etc. And then halfway towards the legal enforcement, we can carry out some mid-evaluations to look at the effectiveness and do the necessary adjustments. So it is not that easy to do this overnight. We all agree, we all know that it is difficult, but I think our mandate is to provide safe, wholesome food and safe living conditions for our people. Right. With that, I would conclude my presentation, and we can have a discussion. These are my views. There may be a lot of different other views we can discuss, and there's nothing perfectly right. There's no perfectly right opinion. So we can have a good discussion. Thank you.
Yeah, Dr. Sanjika Pereira, now over to you for moderator duty.
Okay. Thank you very much, Professor Ruchika, for very informative and very interesting discussion you have started. And before the presentation also, there are a lot of comments on what you going to present and the things what we are going to expect. And I think you would do the justice for the topic. And for all the participants, you can directly ask questions from Professor Ruchika, or you can put forward your questions in chat box. That's another way. And for the beginning, I would like to have a small clarification from you, Professor Ruchika. That is, you were emphasizing on social institutions, and I fully agreed with you, because they are one of the most strong cultural institutions that informally govern your thoughts, your actions, and everything. And apart from that, do you think that politicians also as an institute play a major role in implementing of public policies? For example,
Yes.
Sometimes even though the government officials or other stakeholders need to have a strong policy, for example, like land use policy, and it was there in the draft state for about 20 years, because the politicians do not want to commit for that. If there is a policy in black and white, and it will become a law, and they can't play around with it. So what is your opinion?
Exactly. You are very correct in that thought. Actually, now if you look at people give mandate to politicians. Actually, in democratic states, we give our mandate to the politicians, and they are the topmost people who are involved in policy making, like the cabinet and the executive are the topmost people involved in policy making. And also, like as I said, this we have to be carefully think of the level of corruption. Like now, if you make things black and white, like let's say land use policy, or how you give land to agricultural purposes. I mean, if things are black and white, some people will cannot exploit the system because now if I want to go and get a land for agricultural purpose, for me it's very difficult. But some people know how to get it done because of this corrupted system. So we have to pay attention. And also that is why I think as government officers, I mean, sometimes we are helpless. I know what happened during this egg issue and all this. The politicians put enormous pressure on our officers. But I think we have to stand and say, like, this decision, I mean, sometimes very difficult, I know, like sometimes we might have, like, sometimes you can't bear the pressure. But you have to at least always try and say, at least they know that it's difficult for run these, make policies according to their own discretion. They have to know that it should not be an easy task. But I doubt, like, that we can't expect 100% right thing from the politicians, but we have to do to the best extent that we can do.
Okay, Professor Ruchika, do you think that you mitigate that kind of phenomena? Can we have a kind of a thing like, when you put forward, in an election, when a political party should put forward their proposal, their policies and get the approval from that, and the voters have a chance to, if they are violating those policies, if the people have a chance to, sue these people, take them to the courts, will it be helpful?
Yeah, I think personally, I don't think that it will work in that way. So what I believe is this is a long process and a long chain that we can bring about by education. So we have to first let our people, like from grade 1 children, we have to know what are your rights, what are your responsibilities, how to become a responsible citizen. And now when we have a system where we have all sorts of fraud documents prepared to put our children into grade 1 and tell them all these wrong things, I mean, we can't expect a good citizen to be brought up. So this is a very fine issue of education. So we have to work very hard on education and change the culture, transform the society over a little longer period. Because otherwise, what will happen is always there will be people going behind politicians to get their own advantages. There will be a group. So with that group, others' voice may be very less heard.
Okay, thank you very much. Is there any questions from the audience? I haven't seen anything in the chat box.
Dr. Aranda is raising hands.
Okay, Dr. Aranda, yes.
Yeah, thank you, Ruchika, for the presentation. So, I mean, my question is now, I feel like in Sri Lanka, the biggest problem is we are confusing public administration and public policy. So in our framework, where do we establish public policy in our different departments or in public administration system? How does that function? I mean, do we have a functional system going on, at least in the areas that you have experience with?
No, I mean, there are public policies, but their effectiveness, efficiency is the questionable. Right down and now, public policy is like a very broad thing. It does not restrict its scope to one legislation. It will cover many legislations, many institutes. Now, for an example, now when we talk about veterinary public policy, it may run from how you get undergraduate students to the veterinary faculty. It is not the DAPH, it's the Education Ministry and the UGC. What criteria are you going to use to select the best students who will work for the interest of the animals. And also, like, let's say the government sector, the salaries, the promotions, their facilities, if you are given, like, very little fuel allowance, and if you can't go and do a job in your area with that little fuel, what are they supposed to do? And then how things happen? Like, you can't expect all the things to happen in a correct way, right? So that I think this is a broader problem, but I think gradually we have to go towards our expected goals. A main part of this whole thing is education.
So at the moment, how does that happen? For example, let's take our veterinary sector. So who is responsible for this making of policy and for making those policy decisions?
I think we have the executive and the cabinet. Then we have the line ministry. Then we have the major arm department of animal production and health. And also we have, provincial veterinary setups. So I think it's like fragmented, but there is some command going from top to bottom. Now we have to look into all these bits and pieces, and also power struggles, because sometimes there may be, like, when you have the provincial setups, local government setups, the ministerial setups, all these, like, and also we have to understand people work there, have their own attitudes, expectations. So I mean, I can't give you one quick answer. This entity shall do this, but generally, I think the government in power, including the president and the cabinet ministers, and maybe state ministers, and all entities involved in this business is some responsible at some level.
I think Director General Dr. Hemal Kotalawala should like to, involve.
Yes, madam. Please go ahead.
Yes, Dr. Ruchika. Thank you very much for your presentation. Actually, your topic is an eye-opener. Veterinary public. We have, in my opinion, as
we can't hear you properly.
Document, and also in the COVID pandemic, actually the veterinarians, we had to request from the government, please consider veterinarians as essential workers, because the government did not consider veterinarians as essential workers. That means the government doesn't know about the value or the work done by the veterinarians. So because of that, I think that's why I said this is an eye-opener. So we
can't hear you, madam. Dr. Hemal,
hello.
okay.
Can you hear?
Yeah.
Can you hear?
Yeah, now we can hear.
I am traveling. Yes. To prepare a veterinary public policy, it's a broad document. It should be a broad document, and so we have to think about the big picture. So what are the subsectors comes in the veterinary sector? So many sectors are there. Actually, our acts and regulations focused on the public sector, not the private sector, because they all were maybe 20 years ago, our acts and regulations. So now the private sector is being developed significantly. And other sectors are coming, aquaculture, wildlife. So we have to cater all these sectors, public health sector. So combining all these sectors, subsectors, we should have an overarching policy for the veterinary sector, public sector, private sector, all the subsectors, as Dr. Ruchika mentioned, other institutions. So we have to have overarching policy. And also, if we look at veterinary sector policies in other countries, even the private sector and the public sector, there are different levels of responsibility. In our country, that's not there. Anybody can do anything. So, but it has, what are the different levels or tier levels of responsibilities. So such kind of policy should be there for the veterinary sector. So SLVA has arranged this webinar today. So we all have to get together. I think SLVA is a overarching arm. So we can get together and prepare a good public policy for the veterinary sector, covering all the areas and defining the levels and the responsibilities of everybody. Then if we acts and regulations. Acts and regulations are supporting legal instruments to the policy. First, we should have policy. Then, legal instruments are acts and regulations. So, if gaps are there in legal instruments, certainly there are gaps.
You are lost again.
I think she is like traveling.
Can we go back to the chat box and Dr. Ushan Pallai?
Hello.
Hi.
Hello. Yeah. Actually, acts and regulations, they are legal instruments for the policy. First, we have to have a policy. Then, to support the policy, we should have legal instruments. So our acts has gaps now. So then we can fill the gaps. First, when we mark the boundaries of the policy and we define the policy, then we can study about the gaps of the existing acts and regulations to cater the policy. Then we have to amend or prepare or new acts according to the policy. So thank you very much for Ruchika. Yes, SLVA can, I think, coordinate to develop the public policy for the veterinary sector in Sri Lanka.
Okay, thank you very much.
Dr. Sanjika, can I make a comment?
Okay, yeah, sure.
Yes. Thank you very much, Professor Ruchika. Some eye-opening points. I will share two experiences that you mentioned during your presentation. So many policies are based on personal interests. The example is, the rabies control measures, that it was based on one person's personal interest and not one person, a few NGOs and they influence the higher authorities. In 24 hours, they made a decision. And other thing is slaughter policy, all based on personal interest, not based on data. That exactly you mentioned that. And having said that, and I will give an example regarding how the developed countries make policies. For an example, don't misunderstanding me that I'm not taking any, personal view that I took. Accidentally, I came across a House of Commons report on halal slaughtering. There are lots of debate going on in Europe. It is an inhumane method, and they must stop religious slaughtering. But when that particular House of Commons committee, they did a thorough study. They interview all academics. They interview all the slaughterhouse employees. They interview regulators, government officials. They even interview the restaurant owners. as you mentioned that if there is family values and food habit values, so all affects the public policy. So I think if I am correct, they have interviewed about 9 stakeholders. And after interviewing 9 stakeholders only, they gave a report. And still it is inconclusive. They say that there is no concrete evidence that it's an inhumane method. But I'm referring about this about 10 years, 15 years above, around 1920, 12 or 14 paper. So I'm sharing this experience because how they work when they are developing public policy and how we work in developing public policies. So with regards to what is the relevancy of this topic into our veterinary day theme is, and veterinarians are not only the clinicians. So this is also, every public policy affect the health of the people. So when it comes to the you mentioned about the drug residues in the food chain, and you talk about the slaughtering of animals, and everything happens. Everything happens within our profession, but we are just confining our thinking based on the clinical practices as well as some other immediate educational application. So my the relevancy of this topic is to think beyond the box. So then you will become automatically veterinarians are essential health workers. Thank you.
Thank you very much. Dear all, now when you are asking question or giving a comment, because we have very limited time, please make it sure that you are only taking 1 or 2 minutes. Okay, Dr. Susil.
Right. Thank you very much. Thank you very much, Ruchika, for interesting presentation. For my understanding, I may be wrong. I'm still struggling to understand this topic. If it is public policy or whatever policy, I think policy is well above the legal instruments. And policy may not be the legally bound document. It's probably a code of ethics or practices. Say, for example, I personally feel we may be better off without a policy. One example is health sector. I don't think, as far as I know, we don't have a health policy in Sri Lanka, but they control the pandemic using available legal instruments. I think it's, the policy, unless it comes with a lot of political will and commitment, there is no point having policies. We can, because what lacks is the implementation of legal instruments. As Sanjik also mentioned, politicians can manipulate whatever the way they want to implement. So that's where we have the issue, not only politicians, followed by us, government servants, everybody. So that's where the real issue is. It's not you can have many policies, but no point it comes with a good political will. Say, for example, in this country, I don't think stealing is legal, but it continue to happen with the blessings of politicians and the government. So that so no point have a wonderful policy to cover that unless it is implemented. Thank you.
Yeah, Dr. Susil, to add something to that, actually, now according to the broader understanding, now we can't say that we don't have a health policy, because whatever the legal instruments reflect the country's health policy. So basically now when I read more and more, what I figured out is actually all these legislations are part of the policy. We can't say that we don't have a policy, but we have instruments. So these instruments reflect the policy of the government. So now, and also because of the difficulty of having one overarching document to cover all these aspects by many states, they don't essentially have a single document overarching everything on one sector. So these are small bits and pieces of instruments or procedures, programs, activities, but when you collectively take them all, people, so in a broader sense, they call that is the policy with respect to this area. So, and also, I mean, we can develop a sort of very brief overarching policy, that's no harm. But even without that, we can fine tune the instruments, which will eventually change the government policy on certain aspects of profession.
Okay, thank you very much. There are, some two officers can, ask questions because we have a limited time now, running out of time. And in a chat box, Dr. Ushan Pallegam asks, what is the take-home message? Professor,
Take-home message is like,
yes. Is there
we
any
have to work
take-home message?
hard. We have to work hard. We have to work committed. We need to do a lot of change. We need to listen to others. We need to be honest. We need to do a lot of things.
Okay, thank you very much, Professor. I think that is the end of the Q&A session. Yeah. Dr. Hemal, you need to speak again? Okay, no, I don't think so. Okay,
Yeah,
thank you very much.
Dr.
Thank you very much.
Thank you, Dr. Sanjay Pereira. Can you hear me?
Yes.
Yes, we can hear you.
Yes, we can. Yes.
Yeah. Then shall we move to next step? Vote of thanks. I would like to invite Assistant Secretary, Sri Lanka Veterinary Association, Dr. Chatur Priyadarshana for vote of thanks. Dr. Chatur?
Yes, good evening to you all. First, it's very interesting topic, and as DG Madam correctly said, it's a eye-opening session in a broad way about policies, and again with all the data presented by Professor Ruchika, especially with food safety and all. So I would like to first thank you very much, Professor Ruchika Fernando, and getting our invitation and accepting our invitation and delivering an excellent presentation today on behalf of Veterinary SLVA. I would like to thank you very much. And Dr. Sanjika Pereira, thank you very much, sir, moderating the event. On behalf of SLVA, I would like to thank you also. And again, our SLVA president, Dr. Muhammad Ijaz, actually he gave the, how to say, the outline of this topic regarding the World Veterinary Day. So thank you, Dr. Muhammad Ijaz, and also Dr. Sugat Pemachandra. He was coordinating everything regarding this webinar. Thank you, Dr. Sugat Pemachandra also. And more importantly, all the participants. Actually, we had from the Ministry and Department of Animal Production and Health, faculty, and all the veterinarians from the private sector and also the government. So thank you very much, all the participants. Thank you all again. I think we will have another webinar maybe regarding this one. I think we will be able to take this one more than just a document towards the implementation process. So hope everyone's actually their support and help and to get veterinary profession somewhat next level or the next steps. Thank you so much.
Thank you, Dr.
Thank you
Chatura.
very much.
Shall we wind up there?
Yes.
Yeah.
Thank you very much for all attendees. Thank you.
Thank you. Hello.
or